Good afternoon, everyone, and thank you for joining us today in this community chats. I am Sandra Arevalo, and I'm the Director of Community Health and Wellness at Montefiore Nyack Hospital. Today, we're going to be talking about a very important person, me. But that doesn't just mean me, it means you. It means all of us, because oftentimes we don't pay enough attention to ourselves and we give our undivided attention to everyone else. And it's important to know that we need to take care of our well being, our behavioral health, our physical health, our soul, our energy, and also be able to communicate our needs, not only to our healthcare providers, but also to our support system. And if we don't have a support system, then we also need to know how to look for one. We're not alone, and we're gonna be discussing today what to do if you are, so that you're no longer alone. And to talk to us about all of that beautiful magic, it sounds like magic to me, like a fairy tale world, is Sean Wallman. And Sean, tell us a little bit about you and your agency. And Sean has been with us multiple times here in community chat. So thank you so much for once again joining us and sharing your expertise.
Thank you. Always happy to join. My name is Sean Wallman. I am a social worker with Johnson & Johnson. And Johnson & Johnson does a lot of fantastic work in the world of mental health. Of course, we have medication that helps support those people living um, with mental health issues. We have one medication or a portfolio of medication, if you will, for schizophrenia. We also have medication for major depression disorder. But we also know that medication alone isn't the only answer as it relates to mental health. So there's a team of people like me. I'm the person located in the New York area, and we pretty much go to various programs around the community that supports patients living with persistent mental health issues, such as schizophrenia, schizoaffective disorder, bipolar disorder, major depression. And we provide presentations, booklets. There's also a fantastic website that really helps folks feel comfortable and confident and feeling like we know it's okay to speak up about our wellness, our mental health goals, our personal goals. So one of our presentations, we title it Making Decisions Together, which really gets it to the heart of what it looks like to be an active partner in your treatment and recovery. So I have a presentation, I have some slides, so I will pull it up. Now, Sandra, just to confirm, we see the green slide.
We do.
Okay, perfect. So today's presentation is called Making Decisions Together. It's part of our suite or our resource library called Hope for Schizophrenia. We don't only identify folks living with schizophrenia, but Johnson & Johnson does a lot of work, and we've had research around schizophrenia. So that's sort of the platform that we utilize. But the topic is called being an active partner in your treatment and recovery. So I'm going to start a bit of my presentation, but for those listening today, begin to think about in your mind what we think being an active partner in your treatment and recovery. By active, I'm not meaning we're talking about exercise at this moment. Sometimes I get that from folks, but what does it mean to feel like we are not passive in our mental health and our goals, especially when we're talking to our support system that might include family, friends, but also therapists or psychiatrists or other counselors. But to get us started today, I like to quickly define what the recovery journey means, and recovery in the context of our mental health and wellness. There's various definitions of what we call the recovery journey. And I really like the call out of the term journey because there certainly are twists and turns that many people experience about around our mental health. Um, so some definitions that we have: recovery is an ongoing process that many individuals work on throughout their life, and each person's recovery experience is unique. Just as a side note, there may be various or different mental health issues that folks might be working through that have various symptoms that people might be experiencing. And just because, for example, if one person may be struggling with anxiety, there might be another person that also might be struggling with anxiety, for example, but the symptoms look and feel different, and also how that person might cope or manage or work through those symptoms also might look different. This third one is also important. Recovery is more than just managing symptoms and includes working towards goals and finding meaning. I like to spend a moment here because somebody might be able to feel like they're managing their symptoms through the use of medication, which could be a fantastic foundational element that helps many, many people living with mental illness. However, if that same person even is on a phenomenal medication regimen, but they're at home watching the same TV show over and over again, playing video games for 12 to 16 hours a day, I would often like to challenge that folks to really dig a little bit deeper inside and think about, what is that managing? Because it might be managing, but it may not be thriving or truly living. So we call out the idea of working towards goals and finding meaning as a way to really encourage people to feel like we are able to and we are allowed to make goals for ourselves. And I spend a lot of time in the community, leading and facilitating groups with a lot of people that really want to identify and look towards the goals that they're working on. The goals simply might be to find something meaningful to do during the day so we don't feel like we're at home all day just looking at the four walls. I've heard people explore what it looks like to work, go back to work, go to school, go back to school, get a GED, connect or reconnect with family members. I've also heard people talk about that they've been in the hospital before with mental illness, and they never want to go back to that time in their life where they feel like they're really, really struggling. And their goal is to really figure out what in their toolkit or toolbox they can utilize to really help them thrive, which might include finding a good mental health provider like a psychiatrist or a nurse practitioner or a counselor, therapist, or social worker, or a positive peer group or friends. So that's why we end our definitions with the statement or the plan or the hope to work with your treatment team to identify a personalized plan that works for you.
So, Sean, according to what you're saying, when I think of the word recovery, I feel that I'm completely healed. This is not gonna happen
Mm-hmm.
again, right? Like the flu. Like, okay, I got the
Yes.
flu and it goes.
Yes,
But that's not the same for a lot of the mental health diseases because they're
that's
chronic
correct.
diseases. So we
That's
don't really recover, we manage. So would
hmm
it be okay to say it's a management journey? Because you
Yeah.
might have a relapse, you know, you
hmm
might forget your medications here and there, start again. Like, you know, I feel like you're never fully recovered. But I don't know. I don't know.
No, no,
Just
that's and I've done presentations with people, family members, fellow therapists and counselors in the audience as well. And I've had people call out that exact same point. Um, Mental health is very much um a chronic disorder for many people, especially when it comes for a lot of persistent mental health issues such as schizophrenia or schizoaffective disorder. I when I see the word manage, just to challenge the community about that, I view it as sort of that word might to some people sound negative. I'm only managing. And my challenge is yes, managing by making sure we have all the tools together. So in the event that we were feeling symptoms come back up again, we know we have the toolkit to manage it and not take a huge step back. But I really like the idea. My presentations are called hope presentations. And that's although many people may struggle with a journey with their mental health, people really do recover or they strive for the idea of um, recovery. I've heard people that are possibly have a history of struggling with drugs and alcohol that they've been managing for many years before figuring out that what the symptoms that they're feeling has to do with our mental health. And it's not that you're a bad person, but there's a biology
Mhm.
element to mental health, amongst other factors, of course. But there is hope and there's support and there's resources, there's groups, there's activities, there's the list goes on and on. Um, so you're certainly not wrong to call out that, but I like the idea it's more. Once we're managing, then what? That's pretty much the crux. Let's see if we can move beyond that.
Mhm.
Sometimes managing might simply be I'm going to spend time to figure out my medication regimen because when it comes to medication for mental health, it's not like taking cold medicine or it's not like taking pain medication because you have a headache because you were stuck in traffic for 4 hours and then you get out of the car and you have a headache. You might take pain medication, you feel much better the next day. For medication for mental health, the medication really has to be in your bloodstream for a week or so. It does depend person to person and medication for medication, but then the medication starts to have its effect. Our body begins to notice that there is a change in the chemistry, the brain chemistry, and a lot of folks I've heard this time and time again. They've took medication, the medication works. At some point, a few weeks later, I'm going to stop taking the medication. I feel so much better today. But that same person stops taking the medication and then the symptoms, it comes back up. Um, that's not to say that there is no hope. Some people take medication for many years, possibly their whole life. The thing about medication, regardless of the sort of diagnosis, medication is out there to help us. And we all probably at some point in our life will take medication as a part of our toolkit to help us in all other areas. Um, Sometimes medication for mental health does have some bias or some stigma to it. You wouldn't talk about somebody who's managing heart disease and talk about their medication that they're taking over the long haul. But somebody living with schizophrenia, you might think that person is different, but the medication is there to help us. And the industry, scientists, doctors, we do make a lot of advancements in medication for mental health over the years. It doesn't happen every single day, but there are new medications always on the market that are available that really fits into that's able to fit into our lifestyle. So yeah, that's a long-winded message, Sandra, to just to help. I want to help the community just explore. We all have our beliefs around mental health and our beliefs around medication and what that looks like. And I think it's important for us to explore it and then also to give that knowledge out to our loved ones as well.
And Sean, since we are talking about medications, I think I would like to make a few notes here, especially if there are people who are either on medications already or
Sure.
considering taking some medications,
Yeah.
right? I think you said something very important. Sometimes we have a headache and we take a pill and it disappears. And
Yeah.
it might be that we have that idea for a lot of other medications that are not the same. So thank
Yeah.
you for saying sometimes you have to take it as long as 3 months to start feeling the benefits. You might feel some benefits instantly, but there are some others that, it might take longer, and it doesn't mean that it's not working. You really have to give it some time. But then at
For
the same
sure.
time, you also mentioned when you get off medications, and it's very important if you're listening and you're taking medications right now that you don't make that choice when and how to stop the medications, because a lot of people
Yes.
can just stop the medication. And that can be a very serious problem. Like, you have to talk to your doctor, let them know
Yes.
you're feeling better, that you wanna really maybe try without it. And they will teach you how to get off the medications, but that's something that you shouldn't do on your own.
Yes.
Just saying.
Yes, I've spoken to so many people, and I always use the term. I don't know if it's the most clinical term out there, but we should not stop our medications cold turkey
Correct.
without talking with your doctor. A lot of people do have the goal of at some point in their life getting off of medication, reducing the milligrams of medication, whatever it might be. That's also we talk about working towards goals and finding meaning. Some people approach their doctor to explore that and then are also open-minded because they're collaborating with their doctor or nurse practitioner. If that person feels that the symptoms do come back, to approach it again with the doctor and then maybe be open to going back on the medication. But even so, I've just as an additional side note, not all people have that goal. A lot of people know that medication is really, really, really important to help with the symptoms. And the goal is to be consistent with medication while also managing or thriving in all the other areas of life, not just the day-to-day task of taking medication. There is so much more.
Okay, I let you continue.
No, really, really worthwhile to spend some time exploring this. I think a lot of people benefit from one, this information, and also for us as community members. I imagine most of us here listening on this call today are not doctors, but it doesn't mean that have the right we all have the right to advocate for ourselves and for our loved ones and for our friends and families and for the community. So this information, you don't need to be a doctor to advocate about medication and mental health. We all have the right to and should feel empowered to. So decisions along the recovery journey. Here are 6 really common when I'm going into programs and I'm talking to people and I'm talking also to counselors, social workers that are in attendance during my presentations as well. The decisions of whether or not should I try therapy? Should I work on a goal of going back to work or not? Should I consider my overall physical health as well. We all know that even though my presentation today is on mental health and physical health and overall health, they all go side by side together. How can I make decisions that are conducive and supportive to both my mental health and physical health simultaneously is a huge decision and crucial and critical. Do I reach out? Do I identify support groups that are able to help me? The decision of, do I explore medication or not? Do I reach out to a potential prescriber, doctor, psychiatrist, nurse practitioner? Do I take my medication consistently every day as prescribed? Sort of what Sandra alluded to. Um, and also housing goals. I've worked in the past as a social worker with people looking to really find more independent housing. A lot of folks I've worked with in the past has had a history of homelessness or have lost their housing in the past, and thinking about what having a safe and stable place to live is certainly a really important decision that a lot of people make. I also, when I'm doing presentations live, I always like to ask the group, what other decisions do you make or think that are out there that you would add to this list of six? And something that a lot of people call out is the idea of decisions to communicate with family and friends who are good, supportive to us. So that's not listed here, but a lot of people throughout their mental health journey have disconnected or lost or are not currently really in contact with family or friends, or uh, they have people in their life that are trying to be really involved and supportive, but over the years that person have turned the other cheek, looked away. And another piece of a decision is, how do I reconnect with those loved ones? So I always just like to call out as that's certainly family members are a critical part of the recovery process. We don't do our mental health alone, and our loved ones, if we're lucky enough to have family and friends in at our table, um, it's a good idea to open up to those support. Not everybody does, and that's why I always also want to include and highlight and underline the importance of the greater treatment team, which might be doctors and social workers and therapists or nurses or peers. Those are treatment team members with various roles that are really, really helpful. In addition to that, the role of a doctor is different than the role of a therapist. So if you're somebody that really do want to be involved and make that decision around medication, you might find a doctor that is able to give you suggestions and talk about milligrams and what the medication could help us with, and help us keep track of it month after month whenever you're going, like, visiting for a follow-up appointment. But that same psychiatrist isn't really a therapist. That's not their role necessarily, and you might want to have an additional level of support. That could be sort of unbiased, which is even different than a family or friend that might have some bias because they've known you maybe since you were a child. So the idea of a support network or a greater support network might include all these different people and all these different roles. So the idea of making decisions together, having two-way conversations. So just again highlighting the idea of a treatment team. So for example, a doctor. That's one very crucial and important role that a lot of people reach out for help, especially around medication. Although they're experts, so just the dark green, just calling that out by TT, just so everybody knows, we mean treatment team. But just for example, think about a psychiatrist. That person went to medical school. They're a professional. They probably helped many people in the past work through how medication and their life and their symptoms all go together. And we should certainly value the expertise of a doctor, but us as patients, as clients, and just as people, we're also experts too. And I've heard so many people kind of express the idea of like, I've showed up to my doctor's appointments and I don't feel like I don't know what I'm getting out of it. And then that person comes back and they say, I have to do a better job at communicating and opening up and talking about my truth and my expertise, what I want out of life, because a doctor isn't a mind reader. They may be an expert, they might help people, but it's really up to us to feel like we're being active. So in the very beginning, I talked about the idea of being an active partner. Here, I want people to think about how can we put that into action. You know, you have a doctor's appointment with your psychiatrist coming up. You have a loved one that has an appointment with their psychiatrist coming up. How can we support them in being active? If we know next week on Monday there's a appointment, how can we begin to prepare today so we don't let the appointment get the best of us and we don't walk out of the appointment and we walk out of the office feel like I didn't make the most of it? It could mean by writing down questions. It could be simply preparing. It could be writing a letter to your doctor so you can simply prepare it, present it to them and they can read and then you could start the conversation. Whatever we can do to be active, that's the most important thing, not passive. Passive would be like you're sitting in front of your doctor, you feel like the doctor didn't quite understand you, or they're using big language that you don't quite understand because maybe they went to medical school and that's seeping out while they're talking to you. We have the right to say, hey, doc, I didn't quite understand what you meant by that. Can you say it a different way? Can you clarify? Can we talk about it a little bit more? That's what it means to be active. Another important question, this isn't a trick question, but do we have the right? Can we participate in treatment and recovery decisions? And most people in most situations, if we would like to, we have the right to participate. It's a meeting amongst two professionals, two experts. We're experts, they're experts too. And we have the right to bring a list of questions if you want. Write questions on your phone and look at it. Bring somebody with you to the appointment. A lot of doctors, they're open to having a family member join in the appointment. While it's not the appointment of mom, it's the appointment of the person being there today, mom might be able to listen while that person is talking with their doctor, taking notes, simply holding hands and just knowing that this is a support environment. That's really what true participation looks like. Who participates in decisions are your choice. And this is where I like to call out that there is an idea of the important decisions around our mental health that we need to make. Again, do I want to take my medication or not? I'm having a tough time remembering to take my medications every day and fitting it into my lifestyle. I am interested in this. For smaller decisions, we might not feel the need or might not want to bring that to the attention of our support or our treatment team. But for bigger decisions, the middle area, I'd like your help and ideas. That's the context. That's the frame where we should be going into and interacting with our treatment team. We don't want any doctor or anybody really for that matter to totally make a decision for us. We might love and appreciate the support, and maybe we do agree and we are collaborating together. But there are some times that somebody is giving us a suggestion and we don't feel that way, and then that's not helping us. I always think back to this was almost 6 years ago, but in my last job, For about a year, I was a social worker and I was working with a young man who he had a goal, and his goal was to really find something meaningful to do. He felt like he had a lot to accomplish in the world, and he very much did. And I knew him for about a year, and almost week after week, he would be really exploring the idea of, will I go back to school? I think that's important. Will I try to work on my resume and get a job? And maybe I can go to school in the future, but right now, maybe I should get back into the workplace. And this person, he was quite motivated. He had a lot one to bring to the table and a lot of good ideas. And I knew him for about a year, and I could have been one to totally say, hey, like, look, like, we're exploring this together. I'm a social worker and I think you should go back to school because of whatever reason. That was not my role. It was not my place. Maybe it was my place to help him explore. But by the time I left that job, he still was trying to make the decision of, should I go this route or should I go that route? And I always just think back and about my time with this person, and it's not up to anybody else to make decisions for us. But when we're making decisions, or when we're making decisions together, it's the perfect time to really dig deep and think about and try to move forward with an idea. Because this person, he didn't take that next step in deciding on whether or not, or which goal he wanted to do. Um, so I'd like your help and ideas. I think that's really a great, fantastic choice of, if you're lucky enough to have a treatment team, or if your loved one is lucky enough to have a treatment team, to really use that moment to explore, weigh the pros and the cons, uh, and try. And if something doesn't go your way and you apply to a community college program, for example, and maybe you don't get in the first time, or you apply to that job, doesn't mean that's the end of the line. We can go back. But we shouldn't have somebody totally make these decisions for you, and we don't have to do everything or carry that load by ourselves. So this is a little bit of a recap of some of the things that we've talked about so far. What information can us, as people, as clients, as patients, share when making decisions? What matters most to you in your life? Your values and preferences, your life experiences and goals. These are the areas where it's so important to be an active partner, not be passive, not let the world or let people try to tell you or make decisions for you. We all have the right to participate ourselves with the support of our support network. And on the other hand, what can our treatment team share with us? We have a doctor, say, we have a social worker, we have a peer. Healthcare professionals on your treatment team can provide information about treatment and medication options. Probably a doctor would be the best person to go to. Details about the pros and cons of each option. With a doctor, the doctor might be able to say, hey, there's two of these fantastic medications out there. There's pros and cons of how to go about this. Let's explore it. Somebody might have a totally different goal and might be talking to a social worker or a therapist, and they may also be able to weigh the pros and the cons. The pros of doing this, the cons of doing that, or the cons of doing this and the cons of doing that. I think back, I do a lot of groups in the community, and I always remember, at this point, it was probably about 2 years ago now, but there was a really powerful moment in one of my presentations where somebody raised their hands while we were sort of talking about this. And he said that he recently made a pros and cons list about the idea of going back to work. He listed many, many pros of why he should go back to work, but he was still trying to move forward with the decision. He wasn't there yet, but the pros and cons list was really helpful. And I think we worked on the pros and cons list then, because I have a resource on that. And I think he said the pros were things along the lines of, I know I can do it. I know I can work. I want to make money. The working will help with that. It'll be able to keep me busy during the day. Like has a resume ready to go, and they were like, boom, 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 check, check, check. These pros, and then his con was I'm nervous about doing it. I'm worried about if something would happen or if it just wouldn't work out and I'm scared. That's a very it's a very real con. Even though he checked off all these pros, he did have a con. And during that conversation, we were like, it was a large group. So other people in the audience actually gave him advice and I gave him some advice. And it seemed like after the group we were finished up and he seemed like he felt more confident to lean into the pros. But even if it's something that he felt like he could do, he was still worried about it. And that's a very real emotion, right? So somebody like a therapist, a social worker, a case manager, a peer specialist might be a great person to turn to, along with friends and family as well. Evidence to support information, that's like going to a doctor and asking, tell me more about this medication. The doctor should be able to provide why that person thinks that medication would help you specifically. Additional mental health services. There are a lot of resources out there, and local doctors, social workers may have contacts with resources and community services and things out there. And approaching your treatment team, being open-minded, could help with the idea of other resources that you might have. For example, I've spoken to staff members before that they have told me that they work closely with GED programs, or there's a relationship with um like a going back to work program that program knows about, and they were able to be that liaison person to help that person um connect with the right people. That's the power of a treatment team. So we could talk all day about being active, not being passive, speaking up, coming prepared, doing all the things that we need to do, but it's not always easy. Sometimes we don't know the words that we have to really express ourselves. So there's this idea of communication is key, and there's six very common ideas around like how do we really communicate? Honesty, partnership, trust, culturally appropriate, being informed, and openness. So, honesty. Can I or do I feel comfortable being honest and talking about something that might really be weighing on me with this person? I've met people at programs that said the first time I met my therapist, that person was a stranger. It took some time to feel like they felt confident and opening up. Maybe they weren't honest. Maybe they didn't feel like they had a partnership. They might have felt alone. So, am I honest with myself? Am I honest with other people? Partnership is also the idea of being an active partner, knowing that there is a partnership out there. Trust. How do I know I can trust this person? That's a really important question to ask to a brand new psychiatrist, a brand new doctor. I've also spoken to people that said they've had a treatment team and they've had a social worker, and then that social worker, that therapist, got a new job. That social worker had a baby and isn't there for some time. That social worker got a promotion and are no longer their social worker anymore. And now they're introduced to a new person that they had such a bond with the first person, and now they have to open up again. And that feels frustrating, defeating. I have to talk about my feelings again to a new person. And I totally empathize and I understand that. I've also spoken to people that said, I am grateful that I've had multiple treatment team members with different advice, different feedback, different personalities. So I always encourage people, if you're in a situation where your psychiatrist, she retires, she moves, whatever, your therapist, it moves to a different location, whatever it might be, we reap the advice and the information and the support of those around us the best that we can. But there might be instances where you might have to open up again and explore, do I trust this new person? And be open to this new person. It might not always be easy, but the support network does evolve over time. And that new person might have advice, but not shutting off. I think I was doing a group last month and somebody told me that I think there's something, their social worker or counselor or therapist moved, or they got a new one. And that person said that they stopped going to therapy and then they stopped taking their medication and there was a snowball. And at this point now they reach back out for support and they're back on their medication. And essentially he regretted not pursuing with himself with a new therapist because he did take a step back essentially, and then he was able to follow up and get reconnected. But um, he didn't he it wasn't a he didn't like that experience, like just feeling like he was alone and wish that went through the process. So anybody, don't be like that person. Don't learn from his mistakes and also be open and trustworthy. There's also this idea of culturally appropriate care. We might have a therapist or a doctor that is of a different background as us. We hope that that person has advice and we can open up to and their understanding. I've also spoke to people that say that they've been through, like, they may experience, say, schizophrenia, and their social worker, their therapist doesn't have schizophrenia. So they feel like, how can this person really understand what I'm experiencing? But there is this idea of culturally appropriate care, and it's okay to explore that sort of dynamic with your treatment team as well. Fifth, being informed. We have the right to be informed, and we also have the right to utilize any resource as we can to get information. But it's really important to just not rely on the internet or searching the web or WebMD to help us. We have a treatment team for a reason, and that's a personal relationship, not just a broad internet relation relationship. So when it comes to being informed, knowing who to ask the right questions to, that we have the right to utilize our treatment team that way and talk to a person, that's how we that's how we get most knowledge and information. And also openness. Is it okay to open up? I think that's a part of the communication process. So also another recap of a few of the things that we've talked about: establishing a partnership. That's what it means to be an active partner, finding and sharing information. We're experts. Our treatment team are also experts, and we should feel empowered to be active and share how we're feeling with them, and also get all that information from our treatment team as possible. They're the professional staff support. It's also fantastic to have friends and family in our lives. It's not lost on me how important friends and family are, but many of them aren't experts on mental health or medication. They might have heard somebody say something and it's not true. They might have seen something on TV, watched a movie, but going to your treatment team, that's really the professional staff support. And then ultimately making a decision once we've like worked together all these parts. Every day we're making decisions. So these are really areas where we don't always have to reach out for help and support. Whom do I talk with today? Do I wear the white shirt? Do I wear the blue shirt? What do I want to eat for lunch? Which movie should I see today? The bigger decisions, these are the real recovery, the real mental health, the real lifestyle decisions. Should I go back to school or not? Do I want a new housing situation? Do I want to be involved in my treatment decisions? Do I want to get a job? Others, do I want to talk about medication and how medication can fit into my life? I'm experiencing a side effect with my medication. What should I do about it? Should I just keep that to myself, or should I really be active and approach my treatment team, my doctor about it? That's a life decision. Let's just put it in a like an example, like putting what we learned today into action. We have an exercise, somebody's making a decision. They currently live in supportive housing. Supportive housing is a fantastic resource throughout the country. There's a lot of different apartment programs or um, group home, or like, I mean, the list, the certain words go on and on. But a lot of people often want to maybe live more independently at a supportive housing program. They might have an apartment, but as part of the program, they might have a case manager, and the housing case manager checks in with that person every couple of days, once a week, once a month, however the program is structured or where you're at, and check in with things about, are you paying your rent on time? Are you keeping your place clean? If you're having roommates, what does that relationship look like? And living on your own might really be a fantastic goal, but you might lose certain level of support that you find really helpful. So if we're going to weigh the pros and cons of that decision, sharing values, preferences, and experiencing, gathering information and understanding the available choices, weighing the pros and cons to ultimately make a decision. When it comes to decisions about our treatment and these goals, we break it down. Like, there's medication as a possible treatment option, and then there's therapy, peer counseling, peer support, safe and stable housing. We want to kind of put these two different pieces of the puzzle when we're making decisions, especially when we're working on our mental health. We call out schizophrenia here. Again, the company that my company, we do a lot of work around schizophrenia. But we don't only mean schizophrenia. It's a great example. And I often present to a lot of folks living with schizophrenia, or a lot of programs helping people with schizophrenia. But again, anxiety, bipolar, trauma, the same thing. Medication plus supportive treatments, they really go hand in hand together. So choosing a medication option, knowing your medical history. Sometimes people write down their medical history so we can keep track on it. Weighing the benefits and risks of medication. Again, there may be side effects, but there also might not be side effects, or the side effects might be so insignificant versus the positives that the medications could really have us in our lives. But it's a personal journey and decision, and we're not alone with it. There may be side effects, but we can certainly manage them. There are costs for certain medication options. When it comes to medication, there's two main ways, especially for medication for schizophrenia, that are out there. Everybody really knows the idea of pills. So many people take pills for medication, maybe once a day, maybe twice a day, depends on the medication, maybe even like more than twice a day. But the consistent thing is every day. Some people, they look at their pill bottle every morning when, say, they're scheduled to take their medication. They look at it, and it's like a reminder that medication is a piece of our lives. Sometimes that person says, unfortunately, I think I'm feeling okay. I'll take the medication tomorrow, but today I won't take it. And with that, the medication doesn't stay in your bloodstream. There's a study out there that says like when they looked at um, patients living with schizophrenia, if you don't take your pills that supposed to be every day, if you anywhere from skipping it or forgetting about it from 1 to 10 days, so that means almost like you're running out the door because you're rushing and you simply forgot to take your medication one time, anywhere from 1 to 10 days, it doubles that chance of that person living with schizophrenia going to the hospital. That just shows the power of how important medication really is in our lives. And even forgetting to take it one time, could really have an impact. So there's also, many people don't know this, but there's something what we call long-acting medication or long-acting injectable medications. And they're typically given once a month by a healthcare provider, typically a nurse. It depends on the state, though. Sometimes pharmacists are able to give it, and you don't have to worry about taking the medication daily. Your treatment team, and caregiver or family member will have confidence that the medication is in your system. There's also I've heard from family members when I'm doing presentation that it's not coming from a bad place, but family members are every single day asking their loved one, "Hey, did you take your pills this morning? Did you take your pills tonight?" And there's this idea of like butting heads. A long-acting medication ensures that the medication is in the system. You know when the next date of the medication is because it's typically once a month, but you're able to track that with your treatment team and know the exact date to come in next. And a family member and their loved one can focus on many, many other things outside just the routine of taking a pill. Studies show you could remain episode free on some longer acting medications, and they have similar side effect profiles. Just because it's an injection, it's not like a more intense version of the medication. I get a lot of questions about that. It's the same medication ingredients, but it's given a different way, and it stays in your bloodstream. So just because, like, if you're taking, like, the best practice would pretty much look like you're taking an oral medication, and out there's a long-acting variation. And once you figure out that that medication is a good medication and you're taking it consistently and there's no terrible side effects, there's no reason if you try a long-acting version that something new will come out of nowhere. It's the same kind of medication aside from possibly the pinch that the injection might have once a month, for example. But it's a good way just to guarantee that it's in your system. There's a speaker and an advocate that my company works with as a presenter and an advocate, and I was listening to him talk, and he was on oral medications for many years, doing well, and he started to get more into the advocacy space. So he started to fly on airplanes and travel, and he just didn't want to worry about having to pack his medication in the way that he used to pack his medication. So he got on the long-acting medication. It's not only for people that feel like it's not a last resort option. It may have been viewed like that in the past, but with the medications today, it's definitely not a long-acting. Like the long-acting variation is could be viewed as like a forefront option. On that note, we're pretty much at time. So I guess I'll stop presenting, and any final thoughts, or Sandra, take it away.
Thank you so much, Sean. This was very informative. And, as you were presenting, I was thinking how this is applicable to really any situation in the health of people, even if you have diabetes, even if you have high blood pressure, of course, mental health disorders, but, things like making a team with your family, with caregivers,
sure.
communication, open communication, making sure that You don't take everything that you are advised, but you ask questions, and you know that you know yourself better than anyone else. I think
For
it's
sure.
crucial. This is something that I advocate to my patients and the community all the time. It's like we are the experts, like we are seeking,
Yeah,
advice, but things have to adjust to my lifestyle and my wishes. So thank you so much, Sean, for this reminder for many, and this is new information for many others.
hmm
And, please, if you're seeing this recording, follow us in YouTube, community chats, Montefiore Nyack, and also, just copy and paste that link and share it with all the people you know, because this is really information that is for everybody. It's not just for like one type of people, it's everybody. So,
absolutely.
Sean, thank you so much for all of that. And I will see you soon, I'm sure.
Thank you so much. Thank you, everybody, for listening today.
And next week, we're going to be talking about epilepsy. You might never know when you encounter someone who's having an epileptic attack and we want to help, but we don't know how. We will teach you how next week. See you then. Bye bye.